Today we will discuss the complex cystic lesion in a female of 40-year age with history of pelvic pain. Whether this lesion is endometrioma or it is a cystic tumor or whether it is a hemorrhagic cyst. So we will analyze this complex cystic lesion one by one and step by step. Dear colleagues, Assalamu alaikum, Bismillahirrahmanirrahim. I am Dr. Sultan Ayub, working as a radiologist. So I have placed the probe in a transverse direction to appreciate this cystic lesion. First, we should magnify the image so that we can have better visualization. Now here we can appreciate this cyst at the right adnexal region, just posterior to the urinary bladder. This is the wall of the cyst, which is thickened, and here we can appreciate the multiple linear strands, cysts, and internal echoes. So I'm going to show you in the real images and the real ultrasound. Here we can appreciate this linear dot line, this linear dot line. I'm going to zoom it. So now we can have better visualization of this cystic lesion. So look here, these are the echogenic dot line, this dot line, this dot line, this. So multiple echogenic dot lines are present within this thick wall cystic lesion. And we can also appreciate this one. These are the internal echoes present within the lumen of the cyst. So whether these echogenic dot lines and somewhat these solid areas are alarming for 40-year age female patient. So now I'm going to put the color. Whenever we put the color to see the vascularity, there may be low blood flow within the solid component of any lesion. So then we should lower the PRF and also increase the color gain, not too much that it will give artifacts. So I have lowered the PRF up to 5.3 and the color gain is up to 40. So here we can appreciate that after the Doppler setting, we cannot appreciate any vascularity within these linear strands, echogenic dot lines, or these so-called septas we cannot appreciate. So it means that these are not the solid components. These are rather blood byproducts which have taken this appearance. And when we move toward the wall of this cystic lesion, this is the wall of the cystic lesion that may show the vascularity, sometimes the hemorrhagic cyst or the infected cyst or the tumor, cystic tumor may show the vascularity at its wall. So I am going to see the vascularity. Here we can appreciate the vascularity, but when we closely observe, this is outside the wall of this cystic lesion. So whenever we are going to examine, we will scan the some lesion as this one is, we should always magnify the image, zoom it so that we can have better visualization. So this is the cystic lesion. Whether now this is another cystic lesion, we can appreciate this one. If we closely observe, we can appreciate the wall, which is not too much thick as this one, and also we can appreciate that this is an almost anechoic fluid, and this is the echogenic area which is settled down. So this is the debris which is settled down at the dependent part of the cyst, and this is the clear fluid which is having a little bit echo. So this is called the fluid debris level. So these are the both findings. Both system is showing the characteristic appearance of hemorrhagic cyst. So what we have seen, number one, the echogenic strands, linear strands, we call it echogenic dot line, then internal echoes, well defined cystic lesion, and also the cysts have thick walls. And in second cyst, we can appreciate the fluid debris level, and the wall is not too much thick. So at the same time, at the one patient, we have seen the two cystic lesion, and these cystic lesion is showing the characteristic sonographic findings of hemorrhagic cyst. So if we talk about the differential, we can also say that it may be the endometrioma or chocolate cyst. But when we talk about the endometrioma, these cysts should be filled with the low level ground glass appearance, means like a sand which is present at the course of the ocean. So this lumen should be filled with that low level diffuse echoes, while we can appreciate here the fluid debris level. So this is the characteristic feature, main feature of the endometrioma, that diffuse low level ground glass appearance of the cyst. And if there is we can also appreciate this solid component in this. So we can say that this is a neoplasm, but when we put the color with the Doppler setting, we cannot appreciate any vascularity. So if we call it a mural nodule, this should give the vascularity. While there is no vascularity, so we can say that this is not the cystic neoplasm with mural nodule. So in conclusion, we can say that these two are the most likely the hemorrhagic ovarian cyst that is occupying the right-sided ovary close to the uterus, and this cyst seems to be adherent with the uterus, fundus of the uterus. So likely it is a right-sided ovarian hemorrhagic cyst. We can see the hemorrhagic cyst, two hemorrhagic cysts with different appearances. This has the appearance of echogenic dot line, internal echo, thick wall, while this has the fluid debris level. So this was all about the right-sided hemorrhagic ovarian cyst. So in conclusion and impression, we can say that there are two cystic lesions occupying the right ovary that are very close to the fundus of the uterus, while one seems to be adherent to the fundus of the uterus. One cyst is having internal echoes and echogenic dot line and some solid component, but there is no vascularity within the solid component of dot lines, while other is showing the fluid debris level, likely suggestive of the right-sided ovarian hemorrhagic cyst. Thank you very much.